I'm up a little earlier, huh?
Yes, yes, it is.
All right. No problem. Let me share my screen here.
Yeah, first we play your introduction, AV. Then you can start. Then you can go ahead with your presentation.
Okay.
Here I am introducing Latanya Pankey. Latanya Pankey holds a Bachelor of Science in Nursing and Master of Science in Nursing with a focus in Health Systems Management from the University of Detroit, Michigan. She has 20 years of nursing experience in healthcare, providing care for a wide variety of patients in the critical care environment with complex disease processes, along with providing community resources and counseling. She also has experience in bedboard management and admissions and transfers and case management, helping to coordinate and manage quality and safe discharges of patients to the next level of care. She also adds advanced directives, advocacy initiatives, providing sexual assault victims with rape kits and counseling, and patient advocacy and education for medical cannabis use and safe consumption. In addition to her current role as supervisor of integrated case management, Latanya has served in several local and national committees such as Black Nurses Rock, American Cannabis Nurses Association, and Midwest Cannabis Nurses. This is the introduction of Latanya Pan. Thank you so much.
Latanya, the stage is on yours now. You can start
All
your
right.
presentation.
Okay. Thank you so much to the WYN conference and everybody associated with the WYN conference for that nice introduction. Okay, so today my topic is safe medical and recreational cannabis consumption, patient quality and safety cannabis use in the 21st century. Again, my name is Latanya Pankey. I'm going to start off with a disclosure. The information from this presentation is only for educational and informational purposes only. The content is provided to you so that you can make your own decision on if you want to use cannabis or not. Please refer to your physician prior to use. So, our learning objectives that we'll be discussing today include defining what cannabis is and its impact on our health, myths about cannabis usage, safe consumption of cannabis, and risk factors with cannabis use. So I ask a question today. What do you already know about marijuana? And have you come into contact with anyone who's used it before? You can type your answers in the chat. And so the reason why I ask this question is because I've had plenty of friends, family members, patients, and associates come to me telling me about their cannabis stories, some good, some bad. Mostly a lot of negative things have happened with patients who have used cannabis, and it's typically because of the way they consumed and they weren't educated about it. So my goal today is to make sure you have the information that you need to help you have a therapeutic and safe cannabis experience. So we'll start with some cannabis facts. Marijuana, also referred to as cannabis, is the most commonly used federally illegal drug in the United States, with an estimated of 48.2 million people using it in 2019. Smoking cannabis is the most common form of consumption. Cannabis is the most commonly used drug, only second to tobacco and alcohol. The legal cannabis industry in the US is worth $1.5 billion. The US government spends annually over $17 billion on prohibition of cannabis consumption, sales, and purchases. In the United States, there are currently 19 states that have legalized recreational cannabis use. There's 38 states in the US that have approved medical cannabis. So we'll talk about cannabis versus marijuana versus hemp. So cannabis comes from 3 different plants known as sativa, indica, and ruderalis. There's 2 species that comes from the cannabis, your hemp and your marijuana. When the plant is harvested and dried, it's left with a psychoactive drug called marijuana. Marijuana has THC in it. This is what causes the high. It also has a small amount of CBD in it, less than 10%. And then you have hemp. Hemp is derived from the cannabis sativa plant as well. It is a fiber that is harvested from the stalks of the cannabis plant. It is the most strongest fiber on the planet. It is used mostly for industrial purposes. And the hemp plant is where they get the majority of the CBD that they use from. It's very high in CBD. So this chart here talks about the cannabinoids. There's multiple cannabinoids in the cannabis plant. I'm going to talk about 2 of the major and most popular. That is CBD and THC. So we'll start with THC. The other name for THC is tetrahydrocannabinol. It is psychoactive. It is what we call the head high. So how it works is everybody has an endocannabinoid system, and they have receptors. The THC binds to the CB1 receptors, which are most abundant in the brain, which causes the high feeling. And then you have CBD. The other name for CBD is cannabidiol. And how this works is the CBD receptors bind to the CB2 receptors in the endocannabinoid system. And those receptors are most abundant in your cells, your tissues, your GI tract. And this is what they call the body high. CBD is non-psychoactive, so you do not feel high when you're using the CBD. So the next chart over here gives you the benefits of THC versus CBD. So we'll start with the medical benefits of THC. It causes the high feeling. It relieves pain and inflammation. It causes anxiety. It creates a sense of relaxation and also well-being. It induces sleep, and it is also used as an appetite stimulant. And then we have the medical benefits of CBD. CBD is non-psychoactive. It combats or fights inflammation and pain. It combats anxiety and depression. It suppresses seizures and seizure activity. It fights neurodegenerative diseases such as Alzheimer's, ALS, Parkinson's, and Huntington's disease. It also fights psychosis. It fights tumor and cancer cells. And it is an appetite suppressant versus the THC, which is an appetite stimulant. So this chart here, the name of this chart is the THC dosing chart for ingestion. We use this chart for dosing with edibles. As you can see, it has the multiple different emotions here. It has, we use this therapeutic method called microdosing. And it's when cannabis is taken in small increments, very small doses. And so as you can see, the chart starts at less than 5 milligrams and it goes all the way up to 100 milligrams. It also describes the feelings of mellow, mild, intense, and delirium. It talks about the novice user, which is a person who might be thinking about using cannabis, but has never used cannabis before. It shows you where you can start the dosing at, and that's anywhere between less than 5 milligrams up to 10 milligrams. And then you have your intermediate cannabis users. These are patients who may have used cannabis before, but they don't use it on a regular basis. And that's represented by the yellow here. And they can go anywhere from 10 milligrams to 25 milligrams. And then you have your experienced cannabis users. Those are cannabis users who use on a regular basis. And they go anywhere from 50 milligrams all the way to 100. Another cool thing about this chart is it describes the different adverse effects, which is dry mouth, memory loss, also drowsiness, impairment, paranoia, panic, and nausea. So there's multiple ways to consume cannabis. This chart talks about 3 of the main ways to consume cannabis. And what this chart is describing is the onset of effects. So after you consume the cannabis, how long it takes for the effects to start working on in your body, in your system, and how long the effects may last. So we'll start with the inhalation. The inhalation includes vaping and smoking. It has a fast onset. So after consumption, it can take anywhere from 30 seconds to 2 minutes before you start feeling the effects. It has a strong effect peak. It has rapid decline effect strength, and it has a short duration experience. The effects typically only last in your system from 1 to 2 hours when taking when consuming inhalation. And next you have your oral consumption. This is edibles, infused beverages, and it has a delayed onset. So once you ingest or orally consume the cannabis, it can take anywhere from 30 minutes to 3 hours before you can start feeling the effects at all. It has a drawn out effects peak, and it can last in your body anywhere between 4 and 8 hours. And then you have the sublingual absorption. This includes like melting edibles up under your tongue or using tincture drops to absorb up under your tongue. It has a mid-range onset. You can start feeling the effects within 15 minutes. It has drawn out effects peak. It has a gradual decline in effect strength, and it has a mid-range duration of experience. And this can last in your body anywhere between 1 and 4 hours. So here I have pictures of different ways to consume. So we'll start with more familiar terms such as joints and blunts. Joints are cannabis rolled in smoking paper, and you light it up and you inhale. And then you have blunts. Blunts are tobacco-filled cigars. And what typically happens is they remove the tobacco from the cigars, they refill it with cannabis, they re-roll it, and then they light it up and inhale. They also use pipes, bongs, and water pipes to put dry cannabis in and inhale that way as well. And then there's vaping. Vaping is an electronic device that has high concentrations of THC or CBD, and you push a button and it heats up the high concentration of the cannabis, and you inhale the vapors. And then you have infused foods, or they call edibles. You have a picture here of gummy bears, and there's also some infused cereals that they have renamed, such as Captain Munch, Chronic Toast Crunch, and Fruity Loopies. So, factors to consider before consumption. You should know your dose. This is the single most important precaution to make sure that you have a positive cannabis experience. You want to start low and go slow. You want to start anywhere from less than 5 milligrams up to 10 milligrams. You want to wait an hour before you increase your dose if you need to get to the therapeutic effects that you're looking for. You want to hydrate, hydrate, hydrate. Cannabis is an intoxicant. And when you have an intoxicant mixed with a dehydrated system, it causes negative effects. So you want to make sure that you drink plenty of water before consuming any type of cannabis. You also want to drink water while consuming your cannabis because it will help with some of the side effects, such as the dry mouth. You want to pay attention to your physical and your social surroundings. One of the things that cannabis does is it can cause anxiety, and it can cause panic attacks and confusion or disorientation. So you want to make sure you're around people that you're familiar with and you're in a safe, familiar environment. You want to plan your day accordingly. If you know you have activities coming up or places that you need to be or things you need to do, you want to wait and enjoy these activities before you consume your cannabis. And then you want to avoid alcohol or any other drugs while using cannabis. Alcohol and drugs intensifies the cannabis effects. So you don't want to use alcohol or drugs mixing with the cannabis. So here's some effects, both positive and negative, of cannabis. So we'll start with the positive effects: the feeling high or euphoria, the sense of well-being and relaxation. Also, when you're consuming cannabis, it can heighten your sensories, such as your sight, your taste, your smell, your sound, and your touch. And some negative or maybe unpleasant side effects include confusion, delusions, sleepiness or drowsiness, trouble concentrating or remembering, anxiety, fear, panic, damaged blood vessels, which comes from the smoking and coughing, excessive coughing, increased heart rate, paranoia, and hallucination. So here's some things to avoid prior to using cannabis. You don't want to use at a young age because your brains are not fully developed yet. So under 18 is not recommended to use any cannabis. Using cannabis daily or almost daily can lead to dependence, meaning you need it just to feel normal, and we don't want that effect to happen. You want to avoid using cannabis as your main way of having fun or coping with stress. There are more healthier ways to enjoy yourself or deal with negative effects and moods that cannabis just won't fix. Using cannabis with alcohol. As mentioned before, alcohol intensifies the effects of cannabis, so you don't want to use alcohol or any other drugs. Using cannabis when you are at risk of mental health problems. If you have a pre-diagnosed mental health disorder, you want to stay away from cannabis because you're at risk of increasing psychotic symptoms. So for those who have pre-existing mental health diagnosis, stay away from cannabis. And you should also stay away from the steering wheel. One thing cannabis does is it impairs your motor coordination and judgment and other skills that you need related to safe driving. If you must drive after consuming cannabis, you want to wait at least 3 to 4 hours before getting behind the wheel. If you consume cannabis orally, because of the long delayed effect, you want to wait at least 8 hours before you have to get behind the wheel, only if you have to. Thank you so much. And if you have any questions about cannabis or consulting or want to discuss any questions, please feel free to reach out to me at cannadescence@gmail.com. Thank you.
Thank you for your enlightening speech, Latanya. Please, I
Thank
accept
you.
your thanks for a great presentation.
Thank you.
Here is a question from our audience.
Okay.
Researchers says there is lot of consumption of drugs like cannabis in youth. Why is that so?
I'm sorry. Can you repeat that question one more time?
Yeah. Researchers says there is lot of consumption of drugs like cannabis in youth. Why is that so?
Why is that so? I'm not exactly for sure why people have different issues and deal with things in different ways. That's possibly why they use drugs. But I know that cannabis is a natural drug. I know it can be used to help people and to aid into helping people. Um, there's a negative stigma with cannabis because people just think that you use it to get high, but there's multiple medical benefits to using cannabis. You don't have to use the TH form of cannabis. You can use the CBD, which is the body high, but cannabis has a lot of great effects to it. So my purpose here talking about cannabis is to try to decrease the stigma, the negative stigma that comes with the cannabis consumption. There are really a lot of great medical benefits that cannabis can help people out with.
Yeah. Thank you for the answer, and I hope our audience got exact answer from it.
Thank you so much. And thank you, everybody, for listening.
It's a pleasure to have you here at WYN conferences. Looking forward for future conferences.
Thank you. Looking forward myself. Thank you.
Bye.
Bye bye.
Yes. Let's join in the next session.